Welcome to one of my favorite topics. This is my jam. I have a degree in social work with an emphasis in mental health, but I sort of separate mental illness from emotional and behavioral problems, at least a little bit, because I feel like we've all got emotional and behavioral problems to some degree, right? And the emotional and behavioral problems that I've experienced, I think have set me up to help other people who are experiencing them. So if you're watching this right now and you're feeling like, you know what, I've got a lot of things like I'm dealing with personally, if you can recover from those to some degree, if you can like gain some insight into your own issues, that can help you if you're paying attention, if you're intentional, if you get curious as to why is this going on. That can kind of lead you into an insight that you can share with other people that can really help them. When I was like in fourth grade, I changed schools and I didn't have that many friends. And so I started wondering why I wasn't popular and other kids were, right? And I started with like the hypothesis that it was because I was in the middle in terms of height. Like I thought the cool kids were either short or they were tall, but I was in the middle and that's why I wasn't popular, which is like silly, but it sort of like started me on this journey of trying to understand people because I wanted people to like me. And so I started like thinking like, oh, it's their height. But then I like, I thought about it and looked around and I noticed that it wasn't about height. And so, okay, I had to reject that idea. And I just started like kind of on a lifelong journey of trying to understand people, trying to understand myself. I've been to counseling lots of times. I've done counseling where I'm the counselor lots of times, and I'm still really curious. I feel like I learn a little bit about this every day, and so I'm excited to share this topic with you. And so we'll go ahead and get started. So we're going to start with the nature and the extent of emotional and behavioral difficulties. Okay, unfortunately, 1/5 of us who are watching this video, or I guess just in general, I should say, are going to suffer with an emotional or behavioral problem this year. Like not in their lifetime. In their lifetime, I'd say probably over half of people will have some emotional or behavioral problem. But 1/5 of us, 20% of Americans, are going to suffer from an emotional behavior. Probably the two biggest ones are depression and anxiety. Those are kind of the two that usually take the cake in terms of the most numbers. So those are two titles, emotional problems, behavioral problems, that encompass a lot of different things. So while I mentioned anxiety and depression, it also can be difficulty at work. It can be difficulty in your marriage. It can be difficulty focusing. It's a lot of different things. It can be related to the fact that you don't like your job and you don't know what else to do. That can be part of it as well. So a lot of different things here. Mental illness does fit underneath them, but it has to meet a criteria. I think the criteria for mental illness is that it has to impact one major area of your life significantly. So you think about like the person isn't able to perform well at work because of the emotional or behavioral problems, or the person's relationships are melting before them, or there's some sort of thing that's happening that is negative in their life because of the emotional behavioral problems. And so, like, for instance, if somebody is like having anxiety, but they're still doing everything that they need to do, they're still meeting with friends, they're still going to work, they're still in school, then like, do they really have a mental illness, right? Like you said, it should show up somewhere in their life. Now, the problem with that definition is that it may be that like the anxiety causes them to just like drop out of school, but it's like, oh, well now you're diagnosable and now we can bill insurance, but it's like kind of too late at that point almost. So kind of some gray areas there, but it's the issue with not having like there's no x-ray for emotional behavior problems. There's no blood test. You kind of just have to like listen to somebody's story, talk to the people around them, and then from there create a diagnosis. So, all right. In terms of where problems come from, each problem has unique and sometimes numerous potential causes. Like, why does somebody have depression? There are a lot of ideas about what causes depression. Everything from there's not enough nutrition in the soil, to neurotransmitters, to an unfulfilled life, to loneliness, to like gender. There's like all these different like potential causes for any one given problem. All right, the concept of mental illness. I just talked about this a little bit. Let's dive in deeper. What is mental illness? Okay, there's two models that the book talks about. One of them is the medical model. The medical model is what your doctor uses. And so, it's something in the body, and there's a misalignment of something. There's not enough, dopamine in our brain. And so we're going to treat the body we're going to treat mental illness like we would a broken arm, basically. That's the mental model. And the book that we use for this, the Bible of mental illness, is the DSM. We are currently on 5TR as of this recording. What is all that? DSM stands for the Diagnostic and Statistical Manual of Mental Illness. It is about that thick, like hundreds, maybe 500 more pages. Basically, it is a collection of all of the mental illnesses that the group of psychologists who write it say these are valid mental illnesses, and they change every 5 or so many odd years. So for instance, Asperger's is no longer a correct diagnosis because they did more research and they discovered that there's no real line between Asperger's and autism. So now what used to be Asperger's is now just part of autism on the autism spectrum. And so it's kind of a work in progress, right? The other model is the interaction model, and this says there's no such thing as mental illness. There's no such thing as mental illness. That's the idea of this. And what it says is, yes, we have people suffering, we have difficulties, but it's not mental illness. It is difficulty getting along with other people, or because like maybe somebody's, someone's setting fire to abandoned houses, that is not really a mental illness according to this perspective. That is doing behavior that's not socially acceptable, right? Or someone's having unwanted emotions. They're having emotions like sadness, but they don't want to have those emotions. And so, but they would say that's not really mental illness because that's just an emotion, right? Or the brain is deteriorating and that's causing some issues. But that's more like a medical thing that's causing some emotional or behavioral problems. So this is interesting. Having been trained in the medical model and then reading about this like 5 years after I graduated, I was like, I don't know what's true. In my personal model, like my personal mind, I kind of draw somewhere in the middle, and I kind of say something like, in order to work with somebody, in order to bill insurance, you have to play according to the rules, and the rules say that the DSM is the rule book. And so the DSM describes a bunch of symptoms. So in order to have depression, you have to, have feelings of sadness or, fatigue or a lack of engagement. And so it's like, if you have those symptoms, then I'll go ahead and apply the label of depression. But is an actual disease, is it actually a mental illness in the same way that, say, like cancer is a medical illness? I don't know. I don't know, and I recognize that labeling someone comes with a stigma, and it can cause somebody to behave differently because they may say, well, I have depression, so therefore I should stop doing X, Y, or Z, and I recognize that that may be a bad thing, and so I'm cautious around that. And so in that way, I kind of lean more toward the interactional model, like maybe mental illness isn't what we think it is, because again, we don't have like an x-ray where we can look at it and a layman can kind of point to it and say, there's the issue, there's where the break is. and our book talks about how, one patient can have 5 different psychiatrists give them 3 different diagnoses. That's difficult to kind of wrap your head around it and still call that science, right? And so, but anyway, I still think it's useful to use the medical model because it gives a common language. And maybe someone in Ohio has discovered a really cool way of helping people with depression. If we can't apply the depression label, then maybe other people won't know about it, because it's like every illness becomes unique and people can't communicate and share good ideas around how to treat it. So, moving on. A theory about the causes of chronic mental illness. Chronic being 3 months or longer, but usually people think about that as more like years long. So, the term mental illness refers to those assigned such a label by professionals. Okay, so what actually is mental illness? Well, one way of looking at it is it's people who are labeled that way by professionals such as psychiatrists. While I can diagnose people, and I do that, if there's a psychiatrist and they see that person, then their label trumps mine. Theirs takes precedence. Who's a psychiatrist? A psychiatrist is a doctor who has training with people with mental illness. Usually they do their residency as part of medical school at a psychiatric hospital or something like that. And so they have more training, more understanding, and so what they give takes the cake, or takes something. Here's something really important. You should do this with yourself and with your clients. People are more than their illness, and so we don't refer to people as, oh, they're a diabetic, or like, there goes that diabetic, or hey, you diabetic, right? We use, oh, it's Joey who has diabetes, right? So we should do the same thing with mental illness. We shouldn't say like, oh, they're a cutter. No, they're a person who cuts. We shouldn't say, oh, they're a schizophreniac. No, they're a person who suffers from schizophrenia. People first language, because the words we use create mental worlds in our brain. And so if we label them as a schizophreniac or as a cutter, that will become their identity in our mind and in the minds of the people that we share that with. That's like a neuro-linguistic type of thing. So don't do that. So otherwise, the causes can be everything from it could be from, UTIs cause people to have mental illness-like symptoms. It could be the loss of a loved one. It can be the nutritional issues. It can be drugs that can cause that. It can be, our neurotransmitters can be not functioning the way they should. That's the way we understand how medication works, is that it changes the way our neurotransmitters take and receive the serotonin and the other brain chemicals that I can't think of at the moment. There's a lot of different reasons why. Trauma is another belief about what causes mental illness. A lot of different potential causes to these things. It matters because it may be that the cause of the issue is also where the solution can come from. So for instance, if I'm not eating any vegetables, potentially this can cause some mental health issues, at least down the road. Or maybe an allergy would be a better example of this. If I'm allergic to milk, for instance, potentially this is causing some sort of issue there. If, on the other hand, I've been told that I'm an idiot my entire life, and I now think of myself as an idiot, then I shouldn't be surprised if I have low self-esteem, if I have depressive symptoms. And so the cause would be people labeling me as something and me agreeing with that label. And then the issue, the way to solve that is to undo that label. So let's move on. Understanding diversity as it relates to mental illness. As you might imagine, minorities, racial minorities, ethnic minorities, religious minorities, poor people, they often suffer from mental illness and mental distress more so than other members of the population, which is why social workers should think about ways that they can reach out to people who otherwise would have a hard time receiving mental health treatment. Information about mental health concerns for those experiencing homelessness. Okay, so why do we have a lot of homelessness? Well, when we cleared out places like Choate Mental Health back, I think we started like in the 40s, but it kind of picked up a lot in like the 70s and the 80s. That's the deinstitutionalization movement. I think they were good. Some of the intentions anyway were good. We wanted to allow people to get out of a, like an institutional environment and be in the sort of like quote unquote real world in the community with the rest of us. And so that was good. The problem was the community wasn't set up to be able to help those people the way that they could have been set up. And so a lot of those people ended up either on the streets being homeless or in jail, And so another reason why people are homeless is the fact that we don't have enough low-cost housing, especially in rural areas. Sorry, not rural areas. We actually have some in rural areas. In urban areas, I also wonder if maybe homelessness doesn't create mental illness. Our book really says that the people with mental illness become homeless. But I also wonder if I'm out in the street for 6 months and I'm sleeping on park benches and I'm cold and I'm hungry and I don't know where my next meal is going to come from and I'm being hassled by drug dealers and police officers and teenagers, I might start feeling pretty anxious and depressed and begin looking for some substance or other to take away some of the pain. So I think it probably goes both ways. Controversial issues in mental health field. Okay, so there's actually a lot of controversial issues in the mental health field, but the one that we will talk about here is involuntary confinement of people in psychiatric hospitals. I think this, for me anyway, I used to admit people to psychiatric hospitals. It wasn't super controversial in what I did, and I recognize that there may be some things that happen that I just wasn't a part of, but so here's the idea behind this. If you consider me to be mentally ill, which is difficult to pin down because we're kind of always changing the definition of what mental illness is, and I'm seeing pink elephants in my living room, right? And I'm afraid they're gonna hurt my child, right? Do you have the right to take me away and put me in a jail-like setting? I mean, a psychiatric hospital, if it has bars, which the one in Choate does have bars, I can't leave. It might as well be jail, right? I know it's not exactly like jail, but in the sense I can't leave and I can't come and go as I please. I have my freedoms restricted. I can't go to work. I may have limited access to communication devices like computers and cell phones and things like that. You have the right to do that if I'm considered to be mentally ill, right? And a danger to myself or other people. But it's difficult to know, at what point are people dangerous to themselves or others? So you could argue that if I'm worried about my children being stomped on by an elephant in my living room, that I may do something to try to that's going to end up harming the child. But maybe I won't, and maybe having the parent being removed from the home of the children is going to be more catastrophic than anything else. And it's, we have a history of treating people with mental illness really poorly, like spinning them around really fast and dunking them in hot water and burning them at the stake. And Russia put people in mental institutions because they talked bad about the government. And so I can see it kind of in theory. I guess I push back at it because the average person who's put in a psychiatric hospital for something like this is only going to be there for a few weeks. And so that's why I just feel like it's less of an issue today than maybe it was maybe like 20 or 30 years ago, which is all the examples that the book says. Um, but I guess I could see, like, from some extent, like maybe in the future it would be used to put people away who were just, not liked by whatever group's in power. The thing is that we're so cost conscious nowadays that we oftentimes, even if someone's suicidal, they're not in the hospital for more than 2 weeks usually. So, and that's because medications have gotten good. They've just gotten really good at controlling people's behavior. All right, a little bit here about the plea of innocence by reason of insanity. Potentially people are using a plea of insanity to get out of a crime that they knowingly committed. I don't think this happens very much, but I guess every once in a while it does. And so, yeah, I mean, I guess there's an opportunity for misuse. So we actually have there in show a wing that works with people like this. But again, I don't think it's used very often. The use of psychotropic drugs. A psychotropic drug is something that's primarily intended to change our mood, or to, I don't know, tranquilize us, or take away psychosis. Psychosis is we're hallucinating, or we are believing things that are just bizarre, like, that we're Jesus or Napoleon or something like that. By the way, most psychosis is not in the form of a visual hallucination, like I mentioned. Usually it is auditory, and in fact, you might have even had an auditory hallucination if you've ever heard someone say your name and you turned around and no one's there, or no, you don't think anyone actually said your name. That's sort of like a form of auditory hallucination. I actually have a theory about hallucinations, but I won't share it here. You can email me if you're curious. But these have really changed the game for how we're able to treat people who have severe mental illness. Because in the past, if somebody was suicidal, or someone was a danger to somebody else, or they were actively hallucinating, we have drugs that we can give them, and within a matter of like a few days, those symptoms have just really gone down. And so we didn't have those prior to, I think, the 1950s or 60s. And now we've even have like the second generation of drugs, and they even have less side effects than the first. And so we're really can do a lot of amazing things that we couldn't do in the past. The problem here, and this applies to people who are actively psychotic and many other people who are maybe just have depression or anxiety, is that it's a relief of symptoms, but not of the underlying emotional issue. So then likely what is to be expected is that if you only take medications and you don't deal with the underlying issue, then once you stop the medications, the symptoms will come back, right? Maybe, right? So if I have anxiety because I just so afraid that my boss is going to come into my office and yell at me, and I start taking, anti-anxiety pills for that, right? Then and it works, like I'm no longer nervous about it. Then if I stop, maybe that anxiety will come back. Whereas if the person, say, found a good counselor, or just dove into their own thoughts about it, maybe through journaling or meditation, praying, and they discovered that the issue is related to their father and that they're scared of their father, and they go and have a conversation, or maybe 5 or 7 conversations with their father, and they like work out the issue, or they go to their boss and they say, hey, I'm really afraid of you. I just wanted to tell you that, and to kind of like, basically you're embracing the fear, like you're the scariest situation, like you're stepping into that, taking control of it yourself, thereby like weakening its ability to scare you. If you're scared of spiders, and then you like slowly like introduce spiders into your life, it's like you're no longer gonna be scared of them, right? One time I was house sitting for somebody, and they had leeches in their, like a fishbowl type of thing, And I was really weirded out at first, but then I like, I was living there, and so I was like seeing them on a daily basis. And then after like, I don't know, a month, I was like, they're really cute and they're really cool, and there's, so what happened? I just exposed myself to the thing that I was uncomfortable with over and over again, and it no longer had the sting that it used to have. So that is the benefit of action, and that you may not get that from the pills. All right. Mental health is part of managed care. It is oftentimes through our insurance companies. So they get to call the shots as in what a treatment is going to happen and how long that treatment is going to happen. So that becomes an ethical problem potentially, so that if you see a client and they need 8 sessions and insurance is only willing to pay for 4, what do you do there? Right? So that's an issue. But on the positive side, insurance sometimes really wants clinicians to do the evidence-based practice. Evidence-based practice, if we haven't mentioned that already, is the treatment that has the highest likelihood of being effective, that there's evidence to show that this actually works for this issue. So if I have depression and I come into your office, I want you to do the thing that has been proven the most effective to take care of my depression. That's what I want, right? Just like you would want that for anything, when you go to the auto mechanic and and he's like, well, we could do all these different things. You're gonna ask like, well, what's the thing that has the greatest likelihood of being effective? Hopefully at low cost too, right? So, all right. Treatment approaches for emotional and behavioral problems. So historically, people with mental illness were either considered like demonized, or they were considered like saints, or people who had done a moral failure, and that's why they were experiencing the consequences of their sins. As you might imagine, those oftentimes didn't work very well. Although I suppose that maybe in some cultures, when you hear voices, people think that you're hearing from the gods or the spirits, and so you're sort of like elevated in status, and so maybe that's good for the person in some ways. But I can't imagine that's going to help their mental illness. So I don't know. I need to look more into that. Like, what are the long-term effects of people who become chief because they are hearing 5 different voices in their heads. So, but bringing it closer to home, in the 19th century, we started treating people more humanely, and we said, like, people who have mental illness, they need to be going to places that are clean and have open air, and they need to be getting rest and exercise and things like that, which was way better than what we were doing to them before, which was kind of like putting them in the worst places that we could find. And that change, by the way, happened because some journalists and authors wrote about the conditions of the mental institutions, and people were like, "Whoa, we didn't realize it was so bad." And then Sigmund Freud develops his idea that all of our problems come from early experiences, specifically with those from our parents. And so it kind of like makes us realize that maybe mental illness is not so foreign after all, that it's something that kind of develops because of an early life experience. And while today he's kind of dismissed, at least his therapy approaches are dismissed because they just don't work, that idea that early experiences and what we believe about the world, like coming from our mother and father, kind of has stuck with us to this day. So current trends, we're using a lot of psychoactive drugs. A lot of Americans are on things like antidepressants and anti-anxiety pills. And most of the time they're getting those from their primary doctor. We don't have enough psychiatrists, and so people are going to their primary doctors, and the primary doctors are giving them those drugs. And deinstitutionalization, like we're still, like not putting people in institutions like psychiatric hospitals, like Choate, or there's one in Harrisburg, and there's one in Paducah, in
Lourdes, there's a psychiatric wing, but you're not there very long usually. It's usually a pretty quick turnaround. You're coming in on crisis, and you're getting rest, and they're giving you some drugs, and you're having some group sessions, and then usually you're out of there within a week or maybe a little bit more if your symptoms if you have severe mental illness where you're not able to live independently, then you'll probably be transitioned out of that situation pretty quickly into some sort of long term. But usually the long term is in the community. It's in a group home of some sort, because staying in a place like Choate Mental Health is so expensive that it's just very difficult for the government to pay for that, which is who usually ends up paying for it. We have a lot of community mental health centers around here. The Community Mental Health Centers Act of 1963 was created so that people who were leaving state hospitals like Choate could go back to their home communities and receive care that would keep them out of the hospital. So that today places like Choate are mostly used as crisis centers when people are in crisis, but that's only going to last like a week or two, and then they're going back to their homes, back to their communities where they're going to be treated at a community mental health center. So in our area, Arrowleaf is really big. It's in Alexander and Johnson and Union County, and then in Massac, I think we have Massac Mental Health, and I think in like Carbondale area they have the H group, I think it's called. Don't quote me on that, but it usually these do a lot of different things. So the community mental health in our area, no, they have group homes in which people who can't live independently will live, ideally teaching them the life skills they need so they can transition into individual, like living on their own. They do alcohol and substance abuse. They work with youth. They work with runaway. They work with adults. They have a psychiatrist there. They do a lot of different things, especially in rural areas. I imagine they're more specialized in urban areas. There's been a lot of attention paid to trauma. This is actually not something that I learned that much about in grad school, because wasn't something that they had focused on as much. But I feel like now a lot of attention is paid to early experiences that a child has that change the way the brain develops. I think this is really interesting. So, a child's growing up, and at 4 years old, they get into a car accident, and maybe no one's even hurt, but it's really scary. The windshields bust open, and there's airbags going, and there's blood, and parents are all shook up, and that can be a traumatic experience that can actually change the way that a child's brain develops, right? And now the child's 35. I guess they're no longer a child, but they're still having issues, anxiety issues, and they aren't really sure why. And so one of these tests, these questionnaires, like an adverse childhood experience questionnaire, can help identify the trauma, and then with the work of a skilled counselor, they can go back and examine like what happened, and what did you decide about the world as a 3-year-old, or however old the child was, and are you seeing those results now? Because a lot of times what we decide about the world as a child works, and it makes sense given the circumstances. Like, for instance, an easy example would be like if you're a soldier and you're on the battle lines, then what you should learn, what will actually be beneficial, is to learn to always be on your guard. That's going to help you stay alive. And that is appropriate for that situation. But when you come home and you're in the United States and you are living in the suburbs, you know, um, and you're still on guard all the time, then that's a problem. And so it's about switching the mindset. How do you relearn how to live in a non tragic environment? Because it might have worked well when in an earlier time as a child or as a soldier, but today that same behavior, that same mindset is not effective. It's not allowing you to function in your new environment. So how do we go back and change that? Understand information about counseling and counseling techniques. All right, three things here on how to counsel. And by the way, you might be saying to yourself, you know what, I don't really want to be a counselor. Mental health really isn't my thing. I want to do something totally different. The book says, and I agree, but I am biased, but that these skills are what social workers do no matter where they go. Whether they're working with kids or they're working with the elderly or they're working in the job, like as a, on as an with an employer, whether they're even if they're doing research, um, these counseling skills they're going to work if you're a lawyer, if you're an accountant. It's these same three questions or these same three steps rather. You got to build a relationship with somebody because nobody cares what you know until they know you care. And I know that's cliche, but it's actually true. Think about your own life. Think about if you would listen to somebody that you don't know very well, especially if it was something personal, like you had this issue and you really don't want to mess this up, right? And someone comes along and is like, hey, you know what you need to do? You need to stop that, you know? It's, it's like, no, you're not even gonna like you're not even gonna pay attention to that. In fact, you'll probably like get mad about it because you're like, I don't want to be. We don't have the relationship in order for you to speak into my life, right? And so that building of the relationship, and they say that that is probably the primary way that social workers or anybody who's in counseling is going to make a lasting change in somebody's life, right? Because when it comes to people we listen to, it's people we have a strong relationship to, right? It's our mom, it's our partner, it's the neighbor that we've known for 15 years, it's our best friend. That's typically who we listen to. I guess an exception would be like a celebrity, like maybe a celebrity is someone you would listen to because you feel like they know what they're talking about. But moving on, exploring the problems in depth. And this is where questions come in. And if I had to say put in one word, I would say be really curious or have beginner's mind. I think that's like a Buddhist thing. It's like you pretend you don't know anything about the issue. So someone comes to you and says like, I just can't stop like eating late at night, and you just pretend that you've never eaten late at night and you don't have a problem like that, or you don't know anyone who has a problem like that, and so you're really curious, like really, like when what do you eat at night, and how much do you eat at night, and when did this eating at night start, and have you, like when does it not happen, and why do you want to stop, and what are the problems that this is causing, and what are the solutions, no, not the solutions, what's going to happen if you stop doing this, and do you know anybody else who has this, and what have you already tried to do, and like you're just full of questions that you have to ask somebody, and why do you think you do this, and like you're like really really trying to like flesh out the entire depth of the problem, right? Because you are pretending you don't know anything about this, right? And the reason I stress this is because people oftentimes want to jump from building the relationship. Someone says, I have a problem, I eat too late at night, and we want to jump into the solution. Oh, really? Well, here's what you should do, because I used to have that problem, and this is what I did, and now I don't have that issue, right? And you probably just destroyed that professional connection that you had built with that client, right? Because if it was that easy, they would have done it already, right? And so even when it comes to a solution, it's about exploring solutions. You're not giving solutions, right? People typically won't listen to you. I mean, you don't listen to other people. Like it's a common thing. Like we're not that good at listening to advice because when I'm giving advice to people, and I still do it, everybody still does it, but it's kind of like saying like, I know more about your situation than you do, which is like this really, arrogant thing. Like people are adults, like I'm assuming they're adults. If they're a child, it's a little bit different. But even with a child, it's really about helping someone find their own solution. So you ask the question like, hey, what have you done already? And what happened when you did that? What was the good sides of that? What were the bad sides of that? And then, they're like, well, I tried, setting an alarm and, to be done eating and that didn't work. Like, oh, okay, well, what else could you do? I may have a lot of ideas in my own head, during this. I'm going to try to set them down. I'm going to try to like leave them aside. And they say, they say, well, I really genuinely have no idea, and again, you could kind of like, oh, okay, well, if you were, if I was, if you were me, if I had this issue, what would you tell me to do? You know, so yeah, I'm trying to like, just kind of play with this a little bit, and they say, I don't know, and then I can say something like, well, have you ever thought about talking to your roommate about this issue, you know? And then if it's a terrible idea, they might say, "Oh no, my roommate would never listen to me." Da, 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 da. Like they're dismissing it. It's like, okay, but I didn't tell them to do it. I asked a question like, "Well, hey, have you ever thought about this?" You know, and then I could say like, "Well, hey, have you ever thought about taking the foods that you're eating late at night and just not having them in your house?" Because maybe the foods they're snacking on are very different than the foods that they're eating for meals. You know, or have you ever thought about when you get hungry, rather than doing something else, you know? And even if they're like, no, I couldn't, but that might work, and they say, what should I do? I'm gonna try to push that back on them and be like, I don't know, like, what do you think you could do? Because they're gonna know way better than me what they could do. Because I might say like, play on your phone, but they might say, well, that's gonna keep me up at night, you know? And so I don't ever want to get shut down. Like I don't want my idea to ever get shot down. So that's why even when I suggest something, I want it to be something that it's not like shot down directly. It's like, kind of slowly lands, rather than kind of dying there. And so it's not the easiest thing. I would just pay attention, even on a daily basis when people are talking to you about their issue, which everyone's always talking about problems. My class is doing this. I can't. My boss is a jerk. Like people are talking about issues all the time, and you can start with like question number two, like understanding the problem, when did this start? You know what I mean? Does your boss treat everyone like this? What do you think you should do? And just kind of like playing around that idea, right? Um, avoid jumping to a solution quickly and avoid giving the answer because it's probably not going to work. Because even if you're brilliant and you have the right answer, the person may not do it, in which case you're not helpful to them, so you're going to lose professional credibility. And even if it does work, then they become dependent on you, and they're not as powerful as they would be if you just help them find the solution. So, all right, I've beaten this one to death. Let's move on. All right, starting here with establishing a working relationship. Obviously, introducing yourself, doing what you can to make that person feel comfortable. You know, Starting with small talk. Small talk is best when it is about some third issue, like not them and not you. Certainly not them. So you could say like, wow, it's really raining today, isn't it? Like, oh, but I'm really glad it's raining because we needed rain, and like some sort of small talk that's able to kind of break the ice between the two of you. I I don't start with how are you doing, because that question doesn't seem to make people feel comfortable. It's become sort of a social formality that I don't really like. I might ask them if I do want to know how they're doing. I'm going to ask something like, "How are you doing today?" or some sort of thing that's not just "How are you?" Because if you'll notice, when you ask people this question, they typically give you a very short answer, which to me communicates "bug off." Don't talk to me about that. So, um, and then you're starting by saying like, "Hey, like, what brings you in? What are some of the issues that you're dealing with, right?" And then you want to connect with their emotions in some way. So after they've shared with you what's going on, you're saying like, wow, that must feel really overwhelming, or that sounds really hard. Something that communicates to them that you get them, right? When I share my stuff with somebody and they're able to say, wow, Jesse, that sounds really like a lot. If I'm feeling like a lot, if I agree with them, I like melt like butter right before them, and I'm like, you're amazing, you just know everything. Like I just, I really feel good, and I feel, that person really cares about me. So little things like that really make a big difference. So um, exploring the client's concern in depth, and really it's in depth. It's really you're not going to get to a solution quickly. You're really trying to dive in and understand. You are the most curious person there is. You are, like you have a lot of questions. I take inspiration from like interviewers, Oprah Winfrey, Joe Rogan. These people are really, really good at asking a lot of questions around somebody's life and their experiences, and drawing out this just amazing information. And in fact, I've watched videos about when they talk about interviewers and what they do well and how they're able to get people to open up to them about very personal things, even though there's millions of people watching what they're doing. So, all right, moving on. Let's talk about one approach. There's a lot of different approaches. The book names like 17. There's probably hundreds, and there's probably another one was just created, in the last 5 minutes. So, but cognitive therapy is a popular one. Cognitive therapy has the belief that the cause of our emotions and our actions is what we tell ourselves. So it starts with our beliefs around something, and then from that flow our feelings, and then from our feelings flow our actions. So if you want to know why someone's feeling or behaving in a certain way, go back to their beliefs, right? And it's not about what happens to us, it's about what we tell ourselves about what happened to us. The same thing can happen to two people, and they're going to come away from that with very different experiences, because they're telling themselves different things about that experience, right? And so if you want to change that behavior or those feelings, you need to change what we're telling ourselves, change the story, right? Um, the person who has no friends and they are telling themselves, I am a loser. They that that's going to have some impacts on their feelings and their behaviors. The person who has no friends and tells themselves, I don't want any friends. I don't need friends, right? They're going to come away with very different feelings and very different actions. Okay, so it's about cognitive therapy is about exploring the story we are telling ourselves and then changing that story. So you can do things like, yeah, here we go. Um, uh, you can change the self-talk. No, that's not right. But we'll go into this in a minute. You can change the self-talk. So you wake up in the morning and you feel rotten, and you're doing what your cognitive therapist has told you, which is, I am okay today. There's something I have to give the world that is important, and I am going to do that. Right? You say that enough times, and you'll begin to believe it. You'll begin to feel it. Right? You'll begin to have that being. You'll have that coming out of you in your words and your actions. It'll play in your thoughts enough times. Right? And so, another way of changing things, this is not cognitive behavior, this is not cognitive therapy, but behavioral therapy, is doing something. So if somebody, say, is depressed, if they will do something that they believe is meaningful, go out and volunteer, feed the homeless, pick up trash, start a business, form a relationship, that will change their depressive feelings as well. Right? Because it's a behavioral thing. You're doing something to do that. So another thing, you can change the distressing event. Maybe the distressing event is kid on the playground that is bullying. So by telling the principal and having that child not do that, that may change the issue as well, right? What we shouldn't do are the destructive ways of dealing with unwanted emotions, or what my parents used to call self-medicating. And the two most popular ways of self-medicating were through substances and food. Those are popular ways of dealing with feelings. You can eat your feelings, you can drink your feelings, you can smoke your feelings, you can gamble your feelings, right? Other ways of unhealthy ways of doing this would be like shopping or sex, um, even exercise, which we would say is a really good thing. It's actually really good for our mental health too. But if you're using exercise rather than dealing with the issue, it can be like not good, right? Because it's like someone came up to me and they said that I messed up, and I just feel terrible. So rather than dealing with those feelings or talking to that person about what they said, I'm just going to go do 100 push-ups, and that's going to overwhelm my brain, and I'm no longer going to think about the thing because I'm like, my arms are just so sore after doing that. I guess that would be like, it's a destructive way. You're avoiding it. I don't know if it's destructive, but you're avoiding it certainly. Teletherapy, fairly new, brought in mass during COVID. The benefits is that potentially you can access therapy much more easily than you would face to face. The downside is that you are going to miss information, like because it's a screen and you may not be able to gather all the information, the one-on-one, the connection that is created through smells and touch and things like I don't know, just seeing somebody in 3 dimensions is going to change potentially the impact of the relationship. Um, why is counseling, psychotherapy therapeutic? Well, you are going to change unwanted emotions, right? So anger, depression, frustration. You Again, if cognitive therapy is correct, then if you change someone's beliefs about their situation, then you're going to change their feelings, right? Um, and a lot of our mental health concerns are related to feelings, and so if you're changing that through either changing the thoughts or changing the behaviors or changing the exercise routines or the diets or giving people like cold showers, or there's a lot of different like potential like therapy techniques that you can incorporate, that is going to change it. Sometimes also just hearing people out, like hearing their story, is really therapeutic for them because maybe they don't have other people to share that with. And even if they do, you're a safe space because they don't have to worry about maintaining the relationship with you or disappointing you because, maybe they may have a spouse and you might think, well, why don't they just talk to their spouse about their issues? And it's like, well, maybe they're worried that their spouse is going to begin treating them differently because of the things that they share. So, another thing I think, um, one of the reasons why therapy is effective is because we hear our own stories. A counselor or a good counselor is going to probe us to talk about things that other people won't probe us to talk about. And so it causes us to hear our thought patterns or our beliefs. And after we say them, we may decide, you know what, that's crazy. Like, that doesn't make any sense. I'm not going to believe that anymore. So just the act of verbally processing may cause people to change. So, um, yeah. So um, that is the end of this chapter. The only other thing I guess I was going to say is to I think what's helpful is to pay attention to your own thoughts and feelings and get curious about why you are feeling the way you're feeling. Because if you can understand yourself, then you likely are going to understand a lot about other people as well. Not 100% because people are a little bit different, but oftentimes we're much more similar in our desires and our thought patterns than we'd like to admit. And so paying attention, they say like meditation helps with paying attention to things. I also would add that prayer oftentimes helps us to pay attention to our thought patterns and kind of the inner workings of our brains. Putting these things down oftentimes causes us to pay a lot more attention to ourselves. Feel our feelings, as they say, rather than eating our feelings or distracting ourselves from our feelings will give us an advantage when we're trying to help somebody else. So, thank you for watching this until the end. I know it was long.